We now move to some conditions that we typically see later in infancy. We're now on vignette 16. A 9-month-old, chubby, healthy-looking little boy has episodes of colicky abdominal pain that makes him double up and squat. The pain lasts for about a minute. The kid looks perfectly happy and normal until he gets another colic. Physical examination shows a vague mass on the right side of the abdomen, an empty right lower quadrant, and current jelly stools. This baby has intussusception. The terminal ileum is telescoping up into the ascending colon. Every time that happens, there is obstruction, there is colicky pain, the baby is screaming in pain. If you examine the baby at the time, the right lower quadrant is empty, there is a mass higher up. And that piece of intussuscepted bowel, its blood supply is compromised because it's inside the ascending colon, the mesentery is constricted. And it is that ischemia that gives the blood in the lumen. It is that ischemia that produces the bloody, blood-tinged stools, which pediatric surgeons typically refer to as, quote, current jelly stools. Well, this is the second of the pediatric conditions that we had mentioned where a diagnostic test provides therapy. In this case, a barium enema, or air enema, or air barium enema. Because that barium enema is going to show the intussuscepted bowel, provide the diagnosis, and then also is going to push it back. Because the hydrostatic pressure, the weight of that column of barium as it goes into the colon will push that intestine back where it belongs. Now, if the kid has recurrent episodes, obviously an operation could be done to fix that bowel in place or to remove the part of the bowel that is intussuscepting. We have a few more vignettes and then we're going to move to a review again where we'll repeat a lot of this. Vignettes 17, 18, and 19. Common theme to all of them. In fact, the type of question that might very well appear in the USMLE because of the significance of a problem from a social viewpoint. A 1-year-old baby is referred to the university hospital for treatment of a subdural hematoma. In the admission examination, it is noted that the baby has retinal hemorrhages. This is the shaken baby syndrome. Child abuse. A 3-year-old girl is brought in for treatment of a fractured humerus. The mother relates that the girl fell from her crib. X-rays show evidence of other older fractures at various stages of healing in different bones. Another case to suspect for child abuse. A 1-year-old child is brought in with second-degree burns of both buttocks. The stepfather relates that the child fell into a hot tub. Remember this one? We already mentioned this one. Probably child abuse. So in all three of these, the important answer is refer the child to the proper authorities for protection. And again, number 20, we have mentioned this before. We're going to mention it again so we remember it one more time. A 7-year-old boy passes a large bloody bowel movement. In that age group, think about a Meckel's diverticulum and ask for a radioisotope scan, not packed red cells, but a technetium scan looking for gastric mucosa. Later in infancy, here is a picture of intussusception. This is a barium enema, and we see in what should be the ascending colon, we see the small bowel that in fact is intussuscepted there. And this would serve as therapy as well. And we had at the end of our pediatric vignettes, we had examples of child abuse. Here is one such example. A child with a midshaft femoral fracture, something that normally would not happen to the little kid. And this brings us to the end of the pediatric surgical vignettes.